So on 472, you'll see a picture that looks like this. And whenever you see a picture, you want to start looking for clues to tell you if it's an artery or vein picture. And of course, when you're just sitting there, the first thing you'll do is you'll see red and your brain will go artery, artery, artery. But what if on a test these are in black and white or grayscale? Something to think about, okay? Here's what you'll notice. This looks like a candy cane. What is it? It's the aorta. Only arteries have an aorta. If you are looking at a chest shot and you see an aorta, it's an artery picture, all right? Because they separate out the arteries and veins. And just for fun, go ahead and look at the vein picture on page 479. It will look very similar to this. I'm not going to flash it up there, but you can look at it. Notice, no big hook, no big aorta. So that's something that you should notice. I will give you clues for most of the pictures on that as far as the major areas of the body, just to kind of help point it out to you. So go back to our blood vessels, our arteries right there. We are going to start at the heart, which has been removed, okay? And we're going to look at this aorta, and imagine blood goes up right here. This would then be the first vessel it hits. Now, I really wish they didn't have the sternum overlying it, and we could just see the vessels there. But, you know, they wanted it to you to see the depth, so they did it like that. This vessel here then, look, it starts right there. You see that? And it goes up just to where it splits right here. So it's real short. And you see its name over there on the side, right? Brachiocephalic Trunk. Now, what does its name mean? It means arm head. Where's blood heading? To the arm and the head. Away from the heart. You're correct. It's coming out of the heart, right? Because they're arteries. It's going out. Look here. If you follow, this will branch and go to the arm. This will branch this way and go to the head. So that's why they called it the Brachiocephalic Trunk. Blood vessel names mean something. You just have to figure out what each of the different names mean when you're looking at this. Once again, that is the first branch off of the aortic arch. So you might want to put a little 1 by it. If blood continued, look here, it would go oh so far to right there before it went up the second branch, which goes this way. The second branch is the common carotid on the left, so you may want to put by that a little L with a circle around it and a 2, so you'll know the left common carotid is branch number 2. Now look here, back again. If blood continued past the brachiocephalic, past the common carotid, it could then go up right here, which is very difficult to see, but there is a blood vessel right there. And that is called the left subclavian, number 3. Ask people to be able to name the first 3 branches off the aorta in order. Brachiocephalic trunk and left common carotid, left subclavian. Those are the 3. Can you see a right common carotid? Look here. That's there. That's it. Notice the right common carotid doesn't go all the way to the aorta. I wish the picture didn't pop those little things up. It is a branch off the brachiocephalic, as is, keep looking here, this subclavian on the right is a branch off of the brachiocephalic. The way that it works is every time the big vessel has branches, they get new names. So this brachiocephalic trunk becomes both the subclavian and the common carotid going up on the right. Now sometimes the main vessel, like we can see here, it continues down here. This is all one vessel. You can tell that by looking at it, right? Everything else is a branch off of it as I followed that down there. This main vessel will get new names at different places. So right in here, since this is the armpit region, what do you think they call the main vessel there? Axillary. If this was a gross anatomy class or we were getting really more picky with it, we would give you exact borders for where it becomes axillary. But in here, I just kind of tell you that past this branch right here, you'll start to call it axillary as it gets towards the armpit area. And then once it passes the armpit and actually gets in the arm, what do we call it? Brachial. And then look past the elbow, what do they call it? Radial and ulnar. So let's go through here. I will have you check off on this column the ones that you need to know. Right? You need vertebral. Then you can skip a whole bunch and go to axillary. And then brachial. And then radial and ulnar. Well, that's not a lot on that side. If it stayed like that all day, you'd like me a whole bunch. It won't be staying like that, sorry. On the other side, the common carotids, both the left and the right. Both subclavians. The other axillary. However, I will tell you this, that left axillary in this picture, if you notice, see how they just stopped the vessel there? Let's say that's right about where the axillary would begin. So there would be no point in me labeling it there for you. If I wanted you to say axillary, I'm going to be obvious and go to the armpit area like I'm showing you up there on the other side. So if it ended there, I wouldn't do that to you. I just don't think that that's fair, okay? Because it's too close to subclavian, which ends right about there. So it's pretty close. Okay, continuing down, Brachiocephalic Trunk. The next two intercostals, the way the picture's drawn, sometimes it's a little tough when we copy it out to see front and back. So just say intercostal. You don't need anterior and posterior. There's branches in the front and on the back. And then we do the descending aorta in here. And that's it for that picture. The one thing I'll point out, notice this right here, the vertebral. There would be one on the other side. They don't really show it. Why is it called vertebral? It actually goes up through the vertebra. We'll see a picture in just a second. Well, right now, go to 472, right beside you, where you can see that. And here's this picture. So we're going to do this one. We'll do this part first. Now, this one's red, but there's a clue. Look right here. What do you see? That's a curved candy cane aortic arch. Therefore, you know it's arteries. Now, we learned in the last picture that the first branch right here, now we can see it coming up. That is the brachiocephalic trunk, which branches into the common carotid and the subclavian, which you will see labeled there. I will come back down the list and check everything off. I'm just kind of running through it first. Now, as you take this common carotid up, you notice right past here, it branches and splits. See, one goes deep and one stays superficial out here. The one that stays outside is called the external. The one that goes in there is called the internal. Of course, carotid. Which one do you think is feeding the brain? Internal, doesn't that make sense? The internal. And you can come down here now. You can look and see this is where it becomes subclavian. Do you think that's a good place to label axillary? We don't see an armpit, do we? Kind of close. So I'm going to tell you, just like a while ago, I wouldn't ask axillary there. It leads to the axillary, but I don't think that that's the best picture for it. All right. I do, however, want you to see the vertebral. You can see now it coming off, going back and going through those vertebrae. Do you remember what that's called, that thing that it goes through? That hole in the vertebra? Transverse foramen, because it's in the transverse process of the vertebra. Yeah, that was it. Okay, so let's go through the picture. We'll check off the ones I want you to know. Coming down in this picture, vertebral. internal carotid, external carotid, common carotid, subclavian, and axillary in general, but not on this picture. Okay, going up the other side. Brachiocephalic trunk. Clavicle, I think we can handle that. That's collarbone right there. Thyroid, you better be able to handle that after, we had it. The larynx, I will do that, and I will tell you that is the voice box, which we will study shortly. Then we'll go ahead and pick up the lingual. What do you think the lingual goes to? Tongue, good, and the facial, which goes to the face. Not too tough. And the one with the cool name, ophthalmic. Notice its spelling. It's P-H-T-H. It has a P-H then a T-H. If you hear it, sometimes it helps it to stick, rather than just trying to learn it spelling on your own for that one. Ophthalmic would go to the eye. Exactly. This picture, I usually don't do right here because our book has it at the back, so we'll look at it. No, you know what? I will change. I will go ahead and do it now and change up the order. Your book has it right at the back of the chapter, 484. Now this is showing the underneath surface of the brain. The reason I point this out is because it allows us to see the vertebrals. Definitely check those off at the bottom. How they come in and they join together. And they form what's called a basilar artery that goes right up the brainstem. And it's labeled right beside it, or above it. So you got the vertebrals and the basilar. Oh, basilar is labeled on the other side. I like the labeling on the picture up there better than in our book. It hops us back and forth in our book. Then as you get up here, do you see how the basilar has little branches that loop around the pituitary gland? Right there. Now notice these right here, these cut ones. What is the book telling you those are? Right. So notice, those would be going down through the neck, but they have cut them so we don't see them dangling down. They've tipped the brain back. We look at them there and you may not think that those were the internal carotids coming up, but they are. That's a main part that gives blood supply to the brain, and the other one would be these vertebrals. So when I ask you on the test to name two blood vessels that supply the brain, internal carotid and vertebral. Internal carotid and vertebral. And we're very generic about this next thing. This whole group of vessels that surrounds the pituitary there, group name is the Circle of Willis. The Circle of Willis. Guess who Willis was? Yeah, the guy who first put a name to it. All of these, a collection of some of these vessels right here that loop, make a circle basically around that pituitary gland. I do not ask you to name the parts of the circle. However, in our book up here, they have a dot by them. But I don't ask you to label all of those. Okay, the next picture I like to go to would be the leg. 475 is where we see it. If these are arteries, the red leg. If these are arteries, which way is the blood going? Which would be what on our page? Down. Going down, right? The other picture, it was going up towards the head and out towards the arm. Okay? Here it's definitely going down towards the legs. So what do you think this vessel right here is? Before it branches, this tube right here. That's the aorta, and when it's down here this low, we call it abdominal aorta. So I want you to write that in. The abdominal aorta. We will see it very shortly. It's right on your other page if you want spelling for some reason. It's right there where it shows the guts. Now, that aorta splits, and as we've learned, when blood vessels split, they get new names. So we call them the common iliac arteries. Why? Because they're between the bones called the ilium. So if you will, follow here with me. Notice that the common iliac right here has a little branch that goes inside. Do you guys see that? And what's it called? Good, it's the internal. So right at that point, the main tube gets a new name. Becomes the external. So this right here is common, but as soon as that branch comes off, now it is external iliac. Notice they only label it external way down here, but it's external as soon as the branching occurs, because that's our rule. When a main one has a branch, they like to rename it sometimes. Okay, so that's how that goes. Then, you can tell this is really all the same blood vessel, isn't it? Coming down here, can't you see that's all the main branch? Well, when it hops under that little cord, which we'll see named on the next page, this immediately gets a new name right there. But our book has chosen to label it all the way down here. Look at this. It's the femoral, but it's the femoral all the way up here. So have you ever heard of cardiac catheterization where they have to go into the heart and stuff? They like to go into the femorals, usually not the artery because of the pressure so high. They'll go into the vein, but then they'll feed it up through the Vena Cava and up on into the heart through there, which is really pretty cool. That's why if you've ever seen that or had known somebody that had that, they have the scar or they have the incision on their leg down here way up right by their pelvic region, because that's where this blood vessel is very close to the skin. So you can actually feel it pulse right there too. Okay, now the other one we're going to label here is the deep artery of the thigh right there. It really bugs me. They just changed the name of this vessel. It was called the deep femoral, which made total sense, and the book changed it. So I gave up trying to keep everything different, and I'll just let you call it deep artery of the thigh. Okay. But I don't think the nursing program will. I haven't talked to them. I don't know if they use it much, but if they teach a deep femoral, that's the one that they're talking about. So let's check them off. We got common, internal. We skip one, we got external, then we got the deep. And we skip a few and we go to femoral. Now the femoral goes behind the knee, and when it does, it gets a new name. It's called the popliteal now. And then as the popliteal goes below the knee, it eventually gets a branch that comes forward. So look, they call it the anterior tibial because it comes forward. Now if you look with me as I trace it down, watch this up here. So I trace it down there. You see right here's the branch, so one continues to go straight down here and all the way down there. That's the posterior tibial. And then you will see right here on the posterior tibial, there's a branch that goes to the outside of the foot like this. That is called the fibular because it follows the bone. It goes towards the bone, the fibula. And then on the foot, there's a little loop that we like to call the dorsal pedis as it gets down towards the loop. It's the dorsal pedis, or as the book says, dorsalis pedis. I'm okay with dorsal pedis. And those are the blood vessels of the lower leg. The neat thing about the leg is the veins will be so close they will be almost just like that. Just a few differences on them. I should point out that you don't have this picture in your lab book, do you? This back of the leg. You do have one for the veins, though, and you do have this in your textbook. So if you want to learn it better, seeing the foot facing the other way can help you to tie it all together, because here, from the back, you see, oh, this is first branch. It goes forward, anterior. This is main branch coming down. It's posterior. And this is another branch that goes to the side the same way as that one. Second branch is called the fibular. So I just think that it's a good job of showing it. Remember, when you turn your leg around, this is now outside and this is inside. Big toe, little toe. Versus here, big toe, little toe out there. Something you always got to keep in mind when you're doing anatomy. Now I will go to this picture. That looks like this. Bottom of 747. 747, 474. I totally turned that one around. 474. Of course, if you're listening at home and you're on a web class, it's in your lecture book, and I don't have those page numbers with me right now. But you can find it very easily. It is the abdomen. They have removed most of the organs. Here is the diaphragm, which separates the chest and the abdomen. You can see a couple of ribs cut over here, even. And there's a couple of holes there. Hey, if anything's going to pass from your chest to your abdomen, like food through the esophagus, there has to be a hole for it. Blood's going to get down there, there has to be a hole for it. If blood's coming back up, there has to be a hole. So you see these two holes right here, one for the esophagus, one for the Vena Cava. I don't care that you use their exact proper name, but it would be cool if you knew what passed through them, the Vena Cava inferior and the esophagus. So then there would be a hole here, but of course they filled it up with a blood vessel. There would be a hole here for the aorta. So this from right here to right here where it splits, this is all the abdominal aorta. In A&P, they very commonly like you to know the first 5 branches, or the 5 branches, I should say, of the abdominal aorta. And when they say the 5 branches, they mean the 5 branches that are going to organs. So let's look up here. I'll tell you what to put numbers by. This one is obviously the first, and it is a little trunk. It looks like you see 2 there, but it starts out as 1 and then it branches to the 2. So it's called the celiac trunk. It gets a 1. Then you see this little short nub right here, which started off higher, which is why it is number 2. It's called the superior mesenteric. Remember, we're doing arteries. Then these that go sideways to the kidney are number 3. What would they be called? Renal. Then below that, you see these little skinny ones that branch off to the side. What are those going to? They are. So they're called gonadal. So they're going to the ovaries or the testes. And then right in the middle, you see this other one called the inferior mesenteric. Now the mesentery, we'll learn a little bit later on, has to do with the abdomen. It's a covering or membrane, and it's got a lot of blood vessels in it. Basically, mesenteric means going to the abdominal organs. So we have a top and a bottom one. Notice, though, if we talk about these being paired, we mean left to right. There are only 2 that are paired. Which 2 were paired? Celiac's not considered paired because it's a trunk. I know you see it split, right? But that's why. Renal and gonadal. Renal and gonadal. Those are paired. Okay, in addition to all of those, did you get the numbers for them? Did I tell you? Did I finish with numbers? Probably not. Inferior was 5. Gonadals were 4. So let's come over here, pick up the kidneys. Lumbar arteries is easy. That just goes to the lower part of the spine. Median sacral. What do you think about that? What's it going down? Yep, the front of the sacrum, right? That's what's going to be right here. Then over here, I do want you to pick up ureter, which is what? Tube that goes to? It goes from the kidney to the bladder. From the kidney to the bladder, the ureter. So you have one on each side. And we see the common iliac. And we got all those that we did. Da, 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 da. And at the top, diaphragm and inferior phrenic. Okay, then we get this picture, which is right above it in your book. Same picture, except they've left some abdominal organs. Same stuff's going to be there. It's the same body part. Notice they've added a liver, but they've cut part of it out. They left the veins here, which is pretty cool. Now you can see how they lay right beside each other, and if an artery pulses, what does it do to the vein? Squeezes it, helps to move blood through it. Okay? So we are going to start by just going through these and checking them off, and then we'll go back in there. Okay? I think this one's easier to do that with. Liver, inferior vena cava, celiac trunk, hepatic artery proper, common hepatic artery, right gastric, gallbladder. Okay, we're going to leave off the next one. The gastroduodenal you don't need to do. Gastroepiploic you don't need to do. But you do need duodenum and abdominal aorta. Going up the other side, superior mesenteric, pancreas, stomach, spleen, splenic. You can skip the gastroepiploic again, even though I love that word. And we got the left gastric, esophagus, and diaphragm. Okay, a couple of things I like to point out. I don't need to point everything out because you're getting the feel for it, but watch this. This was the celiac trunk. See, it was a trunk right there. If I cover it just right, it looks like one vessel. And now it branches to become two. As we learned inadvertently in the neck and in the pelvic region, sometimes when a vessel splits, you'll have a common, and then you'll have branches off of the common, like an internal and external. So we had common iliac, internal, external iliac. We had common carotid and internal and external carotid. What we see here is this common hepatic becomes the hepatic artery proper. So common comes first. I point that out because this is commonly messed up on the test. I point to the low one and people put common hepatic artery. Remember, common comes first, other stuff comes later. And then the other thing is this superior mesenteric. Look how low it is. But follow me on the TV screen there. And you see it goes behind the stomach, it goes behind the pancreas, and it pokes its little head out right there. You see that? So it is up high. It is the second branch. It just dangles down really far. But it's the second branch because it starts off so high up. And that's it for the arteries. Anybody have a question on any of the arteries before we jump into the veins? Veins are going to be blue because they're deoxygenated and they're systemic, right? They're going to the whole body. So this time we will start with the head. Oh no, the book starts with the leg, doesn't it? Let's start with the head. Why not? Start at the top. Now, we know that veins carry blood to the heart. So this blood would be going which way? Down. Even though I'm not necessarily going to label them from the top down. It's still easier to see a vessel going up and splitting that way. Okay? However, remember blood flows opposite here. It's going the opposite way of how I'm naming them. This, since it is not a hook way down low in the chest, this is the superior vena cava. I know when you see this, it looks like a big old looping aorta right here. But look, this is sticking out of the ribs. This can't be the aorta. It doesn't go out like that. All right? Something to just kind of mention. It doesn't go through the ribs and out that way. Then this vena cava, right about here, there would be a branch that would go towards this side of the person, but it's going straight through there so they don't show it. So that's why this is the brachiocephalic vein right here. You know what? It's better if I do the chest first. I forgot. You haven't seen that yet to know what that looks like. Let's start with the chest. So I will back up. Now it will make more sense. Heart here, superior and inferior vena cava, obviously, going up here, coming down here. Remember, blood flow's all going back to the heart. But here you'll see what I mean. The vena cava right here, it has a branch that goes this way, and then right here it branches and goes up that way. So two branches, one here, one here. Now I need to point something out. This blood vessel does not loop around your collarbone right there. Okay? If you look carefully at your book, you'll see the line right there that vessel is actually behind the collarbone. It's just kind of hard to tell depending on how you look at it. I like to point that out because I think when you see it, especially up there, if you're looking up there, you don't even see the ghosted thing back here. You know, it just looks like a big old looping vessel there. Okay, brachiocephalic veins, they're separate, so it's not a trunk. There's two of them, so there's no trunk here. It's two different veins. They lead to blood vessels going up the neck. In the neck, these are called jugulars instead of carotids. And notice they are two separate veins. So one is internal and one is external, and it's very easy to tell their position. Internal is the innermost. External is further out. And remember, they're draining blood from the head or from the brain, which we'll talk about in a minute. And it's coming back to the heart. Okay, here. Once we get that branch right there, then this tube changes its name. So once it branches up to the internal, this now becomes the subclavian at that point right there. So over here, right here, it becomes the subclavian, and we name it right there. Subclavian because it's under the collarbone, the clavicle, it's deep to it. Subclavian gets out here, and it branches, so we know it gets a new name. This one's easier than the artery. It branches right here. It's in the armpit. What are we calling it? Axillary. Remember, it's axillary, not auxiliary. Okay, it's AX. No U in there anywhere. This axillary goes further. It splits, so we rename it. One is just like before, the brachial. However, there's a new one running down the inside of the arm called the basilic. If we trace that basilic down, we see it at the elbow. It crosses the elbow. And when you go to the doctor or the hospital, they love to stick you there, don't they? That is called the median cubital vein. Median cubital vein. Now, let's go back up. Subclavian comes out. This time we're going to go out here, and we see it's called the cephalic. Who remembers what that word means? It means head. If you know it from class, don't mention it. But if you don't know it, I want you to tell me why you think they call that the head vein when it's in the arm. It's by the head of the humerus right there. So that makes sense now. It's going past the head of the humerus, so they call it cephalic for head. And the cephalic continues down here, down the arm. Now here's the cool thing. That brachial that we saw down the middle, just like in the artery, it splits at the elbow, and we get a radial, and we get an ulnar. And those are both branches off the brachial. So here's what we've done going down. Checking them off. Brachiocephalic vein, right subclavian, axillary. Brachial vein, cephalic vein, basilic vein, median cubital vein. Man, we're doing them all now. Now we can skip and just pick up in the forearm, radial and ulnar. Then we go to the other side going up. We've got the inferior vena cava. We've got the intercostals. I still don't need posterior. And then right up here, skip a couple, you go to the azygous vein. can you see that comes right out or goes right into, depending on how we're talking about it, the superior vena cava right there. That's where it goes. In reality, when we used to dissect cats, the coolest thing, one of the cool things was you pick up their lungs and you look at the back from the inside. You're going from the front and you pick it up and look in there. Totally see that blood vessel running right down the spine. It runs right along the spine on the right-hand side. Okay, above that, superior vena cava, left subclavian, external and internal jugular. Nah. I mean, they're there, but I won't do them since they're not in that picture, okay? If I showed them, I'll show you a picture in just a second where you'll see them, okay? Which is right here, where we will be looking. If we see here, and we'll go ahead and do that now, look, the vertebral go right out the back and go right up into the vertebra, just like on the arteries. Find on this picture the external jugular for me. Notice that the internal and external jugular are completely separate. They never join each other, which is different than the carotids. Okay. What two vessels do you think carry blood out of the brain? Which one? Vertebral's right. What's the other one? Which jugular? Internal. Internal jugular. Good. Okay, so let's name the ones we want to, let's check them off. Ophthalmic, we want that. External jugular, vertebral, internal jugular, brachiocephalic, subclavian, and superior vena cava. Then we're going to do the bottom picture. Sagittal means which way? Show me with your hand. Good, like this. It means this way. Okay? Now, you have a blood vessel, and you may remember this from AMP1. Your skull, your brain, would be like this, and it would have a space going down the middle, longitudinal fissure, and it would leave a little gap right there, shaped like a little triangle at the top. But that triangle runs all the way back like this, right there. Okay? That forms a sinus that they call the superior sagittal sinus. That's what you're seeing right there. So check that off. And then lower down further between the hemispheres where they end, on the inside, there's another one that runs that away. So it's called the inferior sagittal sinus. The other thing I would like you to label here would be the internal jugular. The internal jugular. Just to remember, blood coming out of that brain goes through that jugular. It'd be nice if they labeled the vertebral here and showed it to us, but they're not, so it's okay. Legs. Blue means systemic veins. Systemic veins are carrying blood which direction? To the heart. So on the lower body, it's going which way? Up. The blood's going up. Of course, we're starting at the top and labeling it going down, okay? Remember, blood's going the opposite way. What is this? Good. It's going to the bottom of the heart. It's the inferior vena cava. Where it splits, this is going to sound awful familiar. Common iliacs. Where the first branch comes off, the common becomes the external, and that little first branch is the internal. So you notice we're checking everything off so far. And you should have written in inferior vena cava at the top, or at least IVC, so you would know what that stands for. Excuse me. Then it goes under a ligament here. Now we've got the name of the ligament. It's called the inguinal ligament because it's in your inguinal area. Probably makes sense to most of you. And then as soon as the vessel goes under that, just like before, right here it gets called femoral. However, they're not labeling it till a little lower. This time you will see the branch come off and go to the inner thigh right here and wiggle down the inner thigh. Do me a favor and go to your artery leg and see if there's an inner thigh branch dangling down there. And the answer should be no. This is me helping you to see if I show you a leg picture, how do you know if it's an artery or a vein picture? If you see that vein in the inner thigh, it's the veins. The arteries don't have that one in the inner thigh. They just have the femoral coming down and branching. That's your difference. This one is called the Great Saphenous Vein. Okay, femoral goes behind the knee, gets a new name. Popliteal. Popliteal travels down, has a first branch that comes forward. Well, not actually. The branch that comes forward, I should say, which is hiding, which we don't see right there. They put it behind a band, but it comes out right here. It's called the Anterior Tibial. Now, watch where my pointer is up here. See, here's the popliteal. Here's the split right there. Okay? Now, we remember that one comes right down the back, right? That would be called the posterior. But they're not showing it to us because they're letting it stay behind the bone, so we don't see it. But you can see right here that as something's going back there, eventually there's a little branch that sticks out right here and goes lateral. When it goes lateral, it's called the fibular because it goes to the outside towards the fibula. And then down at the bottom, you have this Dorsalis Pedis again. And then this time they put the back of the leg there for you to look at. So let me help you with this. This vein, this is very busy, but it is very doable if you pay attention to a few facts. Watch this. Behind the knee, main one is popliteal. Below the knee, first branch is anterior tibial. You see it. Second branch, right there, is the fibular. See how it goes the same way? Just a little lower. Okay? That's how you learn that. Where the anterior branches off, right here, this now becomes the posterior. But they didn't label it till way down there. But look, it becomes the posterior right at the branch. So the fibular is actually a branch off of what? The posterior tibial. Okay, here's what you see. You see one little vessel hanging out in the way down here that crisscrosses everything. Look where it comes from. Above the knee on the popliteal, it drops down and travels down the leg from the inside, then shifting over to the outside. It is called the small saphenous vein, as opposed to the great saphenous, which begins in the upper leg. Notice here you even see the great saphenous, which dangles down into the calf as well. Cool thing about those saphenous veins, they can take them out and use them for bypass surgery. It's a common vein that they use for that, the saphenous vein. They can use mammaries as well. Okay, in the abdomen, with all of the organs removed except the kidneys and the adrenal glands, we notice that this is much less busy than the arteries. We see a couple of holes. We're probably going, one's for the esophagus, one is for the abdominal aorta, but they're not labeling them, so that's okay. This whole thing is the Vena Cava, the lower one, the IVC. You can see it going up through the diaphragm right there. So that means obviously, even though it's unlabeled, that's the diaphragm. The cluster at the top, notice it's not just one with a branch, it's a whole bunch with different branches. So they call all of these hepatic veins. Guess what organ they're going to? Liver. We get down lower, we see the renals. And up a little higher, we see the suprarenals going to the adrenal glands. Find for me the right gonadal. Coming off the Vena Cava, right? You see it branching off of that. Where is the left? It's coming off of the left renal. Go up higher, you see it coming off the kidney vein up there. Over 90% of people and cats, even dogs, are like this. For some reason, our right gonadal grows off the Vena Cava, the left grows off of the renal. It's just how it happens. Every once in a while you'll see one that's abnormal, but these are not nice and neatly paired like the arteries. However, they are still pairs. Okay, it's still a pair. They're just not as pretty as the arteries. Okay, here you see the common iliac, internal iliac, and right where that becomes internal, what does this become? External. You also see the ureter here, which they're choosing not to label, but it's the same ureter as the other picture. Okay? You study it, learn how to spell it there, you can learn it here. You should be able to pick up lumbar veins right there. Don't worry about the ascending lumbar. And then we get everything else up to the top, and at the top, the inferior phrenic. I like to point that out because you should remember from AMP1 that the phrenic nerve controls what? C3, 4, 5? Does that mean anything to anybody? I know I didn't teach y'all. C3, 4, 5 keeps the diaphragm alive. A little rhyme. C3, 4, 5 keeps the diaphragm alive. That's called the phrenic nerve. So we see here that there's an inferior phrenic vein. It goes to the diaphragm. That's the point. It goes to the diaphragm. All of that to get diaphragm. When we can kind of see it, right? All right. Lower picture. The big idea with this picture is that we are seeing the circulation through the digestive tract. Yeah, it's over a couple of pages on 481. Something that you may not have thought about yet. Food traveling through your guts has nutrients absorbed from it into the bloodstream. But we want to filter that and clean it because it might not be so clean yet. So we send it through the liver. So look at all these vessels on these organs. They're veins, so they're traveling which way? To the heart, which is up. Look here, they all collect into this. See, all these down here, they're all collecting, coming back to this right here, so they can go in the liver, then out of the liver and up. Okay? This main vein below the liver is called the hepatic portal vein. That portal vein, which I'll commonly say, but you need hepatic on it, okay? That portal vein carries blood up into the liver so that the liver can do what with it? Yes, filter it and send it back to the heart. Name the veins at the top of the liver that send that blood back to the Vena Cava. Hepatic veins. So you see why I make a big deal. Their names are really close, but they're very different. Hepatic portal below, hepatic veins above. Blood in at the bottom, out at the top. By the way, what's this? Inferior vena cava. Make sure you can label that. Okay, so we got to pick up the rest of the stuff. Liver, right here. Small intestine, rectum. I'm just going down the column. Coming up the other side, large intestine. Hey, look, there's a superior mesenteric and inferior mesenteric vein. Why is the superior below the inferior? because they chose to label it there. That's why. Okay? Watch this. Watch this. They could have labeled this right here, couldn't they? Put it up above. They could have labeled it right here even, but they didn't. Okay? Because it goes right back up to here. So they chose to just put its label way down there so you could see it. Don't be confused by that. The inferior travels up to right here and then joins this splenic and goes in right there. And they all collectively go to the hepatic portal. Once again, you don't need gastroepiploic, but I sure love saying it. You will pick up splenic, inferior vena cava. This picture, I don't like the way they've drawn the spleen. In the book, it's better than on the overhead. On the overhead, you can't really tell what you're looking at, so I leave it off. And yes, gastric veins. I would like you to pick up those. If you look on 480, there's a picture of the heart. That's good for you to practice on, study. And that's it for the blood vessels, for those blood vessels right there.